What's going on, everyone? Dr. Tom Walters. In today's video, we are going to look at Achilles tendon pain, Achilles tendonitis, and a three-phase progression to get rid of pain in the Achilles tendon. We're going to look at these two primary areas people get pain, either up a little higher in the tendon or right down here on the bone. So like I said, we'll look at a progression that covers 3 exercises and then one bonus exercise that's sort of newer in the research that most people I interact with don't even know exist, and it's one of the main ones you want to do. So if you've got Achilles tendon pain, stay tuned for today's exercises. With Achilles tendinopathy, our rehab progression is going to change based on the location of symptoms. With Achilles tendon problems, there's really 2 types. The first one is called mid-substance tendinopathy or tendonitis, and it refers to pain up here a little higher in the tendon. If you remember, you've got your calf muscles, they run down, attach into your Achilles tendon, and then the Achilles tendon runs down and attaches on the calcaneus bone. So one type, again, is called mid-substance. It's a little higher here in the tendon. The other type of tendinopathy is called insertional, and it refers to where the Achilles tendon inserts down here on the calcaneus bone. So if you've got pain that's way down here by the bone, that would be insertional tendinopathy. If it's up a little higher, that would be called mid-substance tendinopathy. Our exercise progression is going to change just slightly depending on where that pain is located. If you've got pain down here way down the bone, we don't want to stretch the tendon, so we're always going to do our exercises on the flat ground. If your pain's up a little higher in the tendon, then you'll want to do your exercises on a step. So I've got an exercise step here, or you could do it just on a stair or something at home. When you're starting off rehab for an Achilles tendon issue, or again just looking to build strength with the tendon, one of the best places to start, especially with pain and getting pain under control, are isometric contractions. This applies to most tendons, and there's been a bunch of research on this in the Achilles tendon in particular. So if you have pain that's just there all the time, maybe at rest, it's kind of achy, you're not, it's aggravated even when you're not doing anything, this is where you want to start. Isometric contractions are contractions where we're not moving, and they've been shown in the research to help reduce pain while also starting that strength building process. So in this exercise, we're pretending that Kirsten has issues on her right side, that this is the painful tendon. What she's going to do in this exercise is raise up on 2 legs, both legs together, which helps take stress off of the painful side. Then she's going to keep this position and take weight off of the non-painful side. So she's going to lift that leg up and hold this position. So this is an isometric contraction. She's contracting the muscle, which puts tension on the tendon, and does it without moving. So she's going to hold that for 30 to 45 seconds, and then when she's done with that, put the weight back on both legs and lower down. So she's going to do 4 to 5 repetitions like this every day. So again, up on 2 legs, shift your weight over the painful side, hold for 30 to 45 seconds, and this is the first level of our tendon rehab program. For the second level of this progression, we are going to move on to eccentric contractions. So this is going to start like the last one. What's going to happen is Kirsten's going to shift towards the edge of the step again. You want to make sure you're close to the edge, a little bit farther, a little bit farther, a little farther back. Okay, so for this one, what we're going to do with an eccentric contraction, she's going to again go up on 2 legs, shift over to the painful side just like before, and then slowly lower over about 4 seconds. You want it to be a nice, long, slow eccentric contraction. So again, up on 2, shift over to the painful side, and then slowly lower down. Eccentric contractions are contractions where the muscle and tendon are working but also getting longer. And these, again, can be helpful for building strength and getting rid of pain. They're sort of our middle level of the rehab progression. Okay, so for this one, you're going to shoot for 3 sets of 12 to 15 repetitions. And this can be done every day if the tendon's not getting too flared up, or every other day if you need a day of rest in between. The last level here is our basic single leg calf raise. So these are going to be just done slowly. You want to think about 2 seconds on the way up and 3 to 4 seconds on the way down. This is sort of our last level. If you don't have much pain with the eccentrics, you can just jump right to these. So what's going to happen is Kirsten's going to basically do that whole movement just with the painful side. So she's going to put all of her weight on the painful leg and then just do a standard calf raise with the knee straight. This is going to tend to be biased towards gastrocnemius, this muscle that's on the outermost area of the calf. So again, she's going up and down for 3 sets of 10 to 15 repetitions. Because she's on the step, like we explained before, this is going to be for this middle part of the Achilles tendon. If you've got pain that's down near the bone, just make sure you do all of these on the ground so you don't stretch the tendon. So again, 3 sets, 10 to 15 repetitions to build strength of the calf and Achilles tendon. And that is our last phase, a last progression of this knee straight sort of standard rehab progression. All right, you guys, this is the exercise you've been waiting for. This is the bonus exercise. So this one's really important. There's 2 muscles in our calf, gastrocnemius, which I've talked about a little bit before. We really work gastrocnemius when our knee is straight. Underneath gastrocnemius is an even bigger muscle called soleus that people don't even really know about. They don't even know it exists. But recent research has shown that soleus develops a ton of force. It's really important in function, and in many cases where Achilles tendon pain is present, it's actually soleus that shows some weakness and some deficits and is the one we really need to focus on strengthening. So this is kind of a funky calf raise. Your knee has to be bent. You really need something to hold on to because you're gonna have to shift your weight kind of funny. So it might take a little bit to get down, but just give it a shot. It has a lot of good research to support it right now, and it's one you definitely want to add in as you're rehabbing your Achilles tendon. I'm going to do it on a step here again, but remember, if your pain is down by the bone, just do it on the flat ground. So what I'm going to do is I'm going to grab my step, okay? I'm going to hold on to something, and I'm going to bend my knee to around 80 or 90 degrees. That angle is going to stay right there the whole time. I don't want to be straightening my knee as I do this. So I'm putting my weight on that leg. I'm going to put my hand up here on my hip, and I'm going to do a calf raise basically with my knee bent. So you can see my knee angle is staying the same. My knee isn't bending. I'm not straightening my knee as I do this. So keep your knee bent and then do your calf raise again. So it takes, again, a little bit of practice to figure out how to move just your ankle and not your knee. But that's how we're going to strengthen soleus. That's how we're going to, by bending the knee, we take gastrocnemius out of the picture a little bit. So like the last exercise, shoot for 3 sets of 10 to 15 repetitions, and this one we'll do every other day because now we're sort of into more of a strengthening phase. We're getting past having pain. We just want to build strength in the muscles and in the tendon. All right, you guys, those are the 4 exercises. We've got a progression really that moves through. So what you're going to do when you're rehabbing is figure out where you're at in the straight knee progression. So you just pick one from there and then the soleus exercise. So really you're just gonna have 2 exercises. You just have to figure out where you're at based on how severe your symptoms are. Okay, so let me know if you have any questions down in the comments section and I will try to get back to everyone. All right, you guys, thanks for checking out this video. I hope it was helpful. I will see you next time. Bye.